Namaste. I, JVN Smritika Chatwal, Assistant Professor in Jyoti Vidyapeeth, Women's University, Jaipur, Faculty of Pharmaceutical Sciences, is here to deliver the lecture on Unit 2nd of Biopharmaceutics and Pharmacokinetics, and the topic is Elimination. This topic is the continuation from the previous one. Now, we are discussing in this lecture what are the objectives of this subject. Upon completion of this subject, then you can understand the basic concept in biopharmaceutics and pharmacokinetics and their significance. Use of plasma drug concentration time data to calculate the pharmacokinetic parameters to describe the kinetics of drug absorption, distribution, metabolism, excretion, and elimination. Now, we are going through the unit 2nd, which is elimination. So, let's start our today's lecture, that is on elimination. Continuation. In this, renal drug excretion is our topic, in which renal clearance may be considered as the ratio of the sum of the glomerular filtration and active secretion rates less the reabsorption rate divided by the plasma drug concentration. So the formula is CLR is equal to filtration rate plus secretion rate minus reabsorption rate upon CP. Okay, so what is drug clearance? Drug clearance, also known as body clearance, is total body clearance, or CLT, is a pharmacokinetic term for describing drug elimination from the body without identifying the mechanism of the process. Calculate clearance based on plasma drug concentration data. And clearance is the product of Vd and K1, both of which are constant. As the plasma drug concentration decreases during elimination, the rate of drug elimination decreases accordingly, right? And clearance is constant as long as the rate of drug elimination is first pass process. For example, in penicillin, that has a CLT of 15 ml per minute. When calculating the rate of penicillin, when the plasma drug concentration Cp is 2 microgram per ml, then it will be 30 microgram per minute. Now, in drug clearance, this may be used to estimate the rate of drug elimination at any given concentration. Using the previous example, if the elimination rate of penicillin was measured as 150 microgram per minute, when the plasma penicillin concentration was 10 microgram, then the clearance of penicillin is calculated as Cl penicillin equals to 150 microgram per 10 microgram per ml, and that will be 15 microgram per minute. The elimination rate constant, which is represented by K, is the sum total of all the rate constants for drug elimination, including excretion and biotransformation. Drug clearance is the sum total of all the clearance processes in the body, including clearance through the kidney, which is also called as renal clearance, lung and liver. Liver clearance is also known as hepatic clearance. Now, what is hepatic clearance? Hepatic clearance may be defined as the volume of blood that perfuses the liver and is cleared of drug per unit of time. Total body clearance is composed of all the clearances in the body, where CLT is equals to CLNR plus CLR, where CL is total body clearance, CLNR is non-renal clearance, that is often equated with hepatic clearance, CLH, and CLT is renal clearance. Hepatic clearance is also equal to total body clearance minus renal clearance, assuming no other organ metabolism. The total body clearance of a drug is 10 ml per minute per kg. The renal clearance is not known from a urinary drug excretion study. 60% of the drug is recovered intact and 40% is recovered as metabolites. What is the hepatic clearance for the drug, assuming that metabolism occurs in the liver? This question can arise, and this question is important for many examinations. So the answer of this question is CLH equals to CLT into 1 minus FE. Then CLH is equals to 10 into 1 minus 0.6, that will be 4 ml per minute per kg. So the total body clearance here is 4 ml per minute per kg. Now, what is first pass effect? For some drugs, the route of administration affects the metabolic rate of the compound. For example, a drug given parenterally, transdermally, or by inhalation may distribute within the body prior to metabolism by the liver. In contrast, drugs given orally are normally absorbed in the duodenal segment of the small intestine and transported via the mesenteric vessel to the hepatic portal vein and then to the liver. Before entering the systemic circulation, drugs that are highly metabolized by the liver or by the intestinal mucosal cells demonstrate poor systemic availability. When given orally, this rapid metabolism of an orally administered drug before reaching the general circulation is termed the first pass effect or pre-systematic elimination. Right? Now the AUC is what? Area under circumstance. Area under circumstance for a drug given orally is less than the AUC for the same dose of drug given intravenously. The absolute bioavailability may reveal evidence of drug being followed or removed by the liver due to first pass effect. Drugs such as propranolol, nitroglycerin have F values less than 1 because these drugs undergo significant first pass effect. Now, what is physiological or organ clearance? For any organ, clearance may be defined as the fraction of blood volume containing drug that flows through the organ and is eliminated of drug per unit time. From this definition, clearance is the product of the blood flow to the organ and the extraction ratio. The ER extraction ratio is the fraction of drug extracted by the organ as drug passes through. So clearance is equals to QER. Okay. If the drug concentration in the blood entering the organ is greater than the drug concentration of blood leaving the organ, then some of the drug has been extracted by the organ. ER is a ratio with no units. The value of ER may range from 0 if no drug removed by the organ to 1 where 100% of the drug is removed by the organ. An ER of 0.25 indicates that 25% of the incoming drug concentration is removed by the organ as the drug passes through. The physiologic approach to clearance shows that clearance depends on the blood flow rate and the ability of the organ to eliminate drug, whereas the classical definitions of clearance is that a constant or static fraction of the volume in which the drug is contained is removed per unit time by the organ. Now, what is liver extraction ratio? because there are many other reasons for a drug to have reduced F value. The extent of first pass effect is not very precisely measured from the F value. The liver extraction ratio provides a direct measurement of drug removal from the liver after oral administration of a drug. So, because Ca is usually greater than Cv, Er is usually less than 1. By contrast, if the drug is injected intravenously, most of the drug would be distributed before reaching the liver, and less of the drug would be metabolized. Relationship between absolute bioavailability and liver extraction is revealed by a formula, which is F equals to 1 minus ER minus F double, where F is the fraction of bioavailability drug, ER is the drug fraction extracted by the liver, and F naught is the fraction of drug removed by non-hepatic process. If F naught is assumed to be negligible, that is, there is no loss of drug due to chemical degradation, gut metabolism, and incomplete absorption. ER may be estimated from F equals to 1 minus ER. Estimation of reduced bioavailability due to liver metabolism and variable blood flow blood flow to the liver plays an important role in the amount of drug metabolized after oral administration. Changes in blood flow to the liver may substantially alter the percentage of drug metabolized and therefore alter the percentage of bioavailable drug. The relationship between blood flow, hepatic clearance, and percent of drug behaved bioavailability is F naught equals to 1 minus CLH upon Q equals to 1 minus ER, where CLH is the hepatic clearance of the drug, Q is the effective hepatic blood flow, and F naught is the bioavailability factor obtained from estimates of liver blood flow and hepatic clearance. The hepatic blood flow may vary from 1 to 2 liters per minute depending on diet, food intake, physical activity, or drug intake. Now, for the drug propoxyhene hydrochloride, F naught has been calculated from hepatic clearance, which is 990, and an assumed liver blood flow of which is 1.53 liter per minute. The result showing that 35% of the drug is systemically absorbed after liver extraction. Now, first pass effect is a very important consideration for drugs that have a high extraction ratio. Drugs with low extraction ratios such as theophylline have very little pre-systematic elimination as demonstrated by complete systematic absorption after oral administration. In contrast, drugs with high extraction ratios have poor bioavailability when given orally. Therefore, the oral dose must be higher than the intravenous dose to achieve the same therapeutic response, because in intravenous the drug directly goes to the blood, and if the drug directly goes to the blood, then first pass metabolism is overpassed and the bioavailability is 100%. In some cases, oral administration of a drug with high pre-systemic elimination such as nitroglycerin may be impractical due to very poor oral bioavailability, and thus a sublingual, transdermal, or nasal route of administration may be preferred. For drugs that are come under the BCS classification too, that are poor soluble or poorly oral bioavailability, then we have to make their other dosage forms. For example, nitroglycerin. In this case, we have to prepare sublingual, transdermal, or nasal route. So to give 100% or equal to 100% bioavailability. So that's it for this lecture. If you are, if you have any queries, then let me know. Please let me know and make sure to write short notes about this lecture. And if you have any queries, then comment below and study about these important questions. Okay. So thank you so much for listening.